Health Check is presented by
Island Cancer Center.
The whooping cough outbreak continues to plague our island. To date, there have been 27 confirmed cases of whooping cough, also known as pertussis, reported to the Department of Public Health. And according to immunizations program coordinator Annette Aguon, so far we have been lucky that none of the cases have resulted in death.
In the past, when the outbreak first started in the springtime, we did have some that were as you were when we had some in the school, it was close contact or among family members. The most recent cases have no known link based on our investigation. They're isolated. They're separate cases. They're not related to each other. It's just that they were reported to us within the reporting week.
Pertussis can only be diagnosed through a lab test, as the disease displays cold-like symptoms and doctors must rule out other conditions such as bronchitis or asthma. This makes it difficult to pinpoint where or when the disease was contracted. But why hasn't the outbreak ended?
Unfortunately with pertussis, because it is spread through the air, which is really easy, and it's difficult to diagnose right away because it starts as a common cold or bad flu. It does take several months before an outbreak may end, and only because it takes a few weeks for those symptoms to either persist or worsen, and then that's when maybe individuals finally seek medical care.
She says they have come close, but unfortunately additional cases were reported.
Again, because we have not declared the end of this pertussis outbreak, it takes two incubation periods, which is 42 days from the last time a reported confirmed case is seen by public health, where we can say, oh, the outbreak is over.
Aguon says like many communicable diseases, pertussis can be prevented through vaccination. Without vaccination, not only do you put yourself at risk, but also your community. That is why it is extremely important to immunize.
Our concern has always been when we see young children, and unfortunately we have a 1-year-old, and so again, besides promoting vaccination to those around the baby, newborns, it's also proper hygiene and cough etiquette, because that's the only way that we can prevent further spread in the household and then unfortunately to the community.
And with the start of the new school year, it is important to immunize. According to Aguon, the pertussis vaccination, or DTaP, is a requirement for school to protect your child, your family, and your community.
Health Check is presented by
Island Cancer Center.